Chris Bernowski. I'm the nurse at the Transition Center. Would love to cover how we empower our students to become independent medically and live healthy lives. Being a nurse at the Transition Center, there are so many things that medically we can assist our students with for daily living skills and prepare them for the future for independence. I provide monthly lessons to our young adults covering healthy living, and we discuss, things from my plate, which is how to eat appropriately with the proteins and the vegetables and the fruits, to reading food labels, meditation. The young adults love meditation. We even do, of course, hygiene. We do a lot of hygiene here, and it's very important, not just for health reasons, but also because of our vocational program. Some of our young adults might be moving on to independent living arrangements, and in order for them to be prepared and empowered to take care of themselves, we do provide and organize a healthcare notebook for them, which will have physicians' addresses and phone numbers and a log of when they need to visit. If they're on medication, we can set up where they learn about why they're on the medication, what side effects can occur, the dosage, how to take it responsibly, and if there's any problems, of course, to consult with their physician. If any of our young adults need to take medications while they're here at the Transition Center, we provide supports for them to be responsible to take their own medication. And it could be pill boxes that we have here. There's great apps. There's tons of great apps out there for everything. And for them to recognize when they need to take it, and maybe even when they need to get it refilled, so that they could really promote their independence at home as well. There are also students that we have here that have medical plans, and it's utmost important for them to understand what their plan is and be responsible to have that information with them, especially when they go out into the community, so that if something occurs, they have resource to say, hey, this is my medical condition, I need help. They have this information in their phone, and it could be easily accessible to emergency medical system or any standby that is there to help them in the case of an emergency. And students can also put the information of their physicians in their phones so that they can have that for future reference. One of the challenges, at least being female, is that you always need to be prepared for your menstrual cycle. And this happens to our young ladies here as well. So we do provide supports for them to recognize how I can be prepared in the future. If I'm at the Transition Center, or wow, I'm at work and this happens, what do I do and where are my supplies? So a lot of this we do discuss with the students, and we kind of customize what works for them and how they can remember that. I cannot stress the great abundance of apps. We had put a couple that we suggest down below on the link for you to look at. But again, there's a whole plethora out there. Just to recap, again, we are here to empower our students to become the best that they can be and to live healthy lives. And we do this by instructions in the classroom, individual time to review things and make them understand in their own terms. And all of this really helps to make them the best that they can be. Please feel free to see the links below, and don't forget to subscribe to our channel.